yield myself 4 minutes.
Gentleman is recognized.
Mr. Speaker, I rise in strong opposition to H.R. 2, the Republican Patients' Bill of Rights Repeal Act. The question is just simply fundamental here, whether or not people will be able to have control over their health care needs and their health insurance needs, or whether or not we will go back to the chaos of the previous system that is dictated by the insurance companies, where people are thrown off of policies willy-nilly, where people are not reimbursed for cost willy-nilly, given excuses, paperwork back and forth, where young people are thrown off their parents' policy at the age when they graduate from high school, and whether or not they will have insurance or not, or whether people will have the freedom to make the choices to have insurance that will cover them, that will get rid of the pre-existing conditions that eliminate their coverage, that will get rid of the lifetime caps so that those people who contract cancer or other chronic diseases find out they've run out of insurance at the exact moment that they need it. No longer will that be the case under the current law. Now the choice is to repeal that law and to make it more difficult for small businesses to provide insurance. Since the enactment of the tax credit under this law, we now see that hundreds of thousands of employees have been extended health insurance by small businesses employing 50 workers or less because of that tax credit, a tax credit that is scheduled to increase. So we already see that hundreds of thousands of employees that did not have access to insurance because they worked for small businesses today have insurance. That's not the reporting of the government, that's the reporting of the health insurance companies, where people and businesses are making application for insurance. So what we see now is young people are once again covered and can have the security that they'll have health insurance while they go to school or while they start a new job that may not have health insurance with that coverage. We now see that people who may have had a bout of cancer early on know that that will not disqualify them from having insurance as they go out and continue to work to provide for their families. We now see that after 2014, when people change their jobs or they lose their jobs, they will have insurance. So they will not have to go to the poorhouse because of the insurance costs that they will not be able to provide for because they're unemployed. They will not be locked into a job that they don't want. They will be able to be entrepreneurial and go out and seek a new job knowing that they will have health insurance. That's the certainty of this legislation. We can now choose the chaos of the current insurance system. We can choose the chaos of people getting a letter saying you no longer have insurance. Getting a letter saying your child is no longer covered. Getting a letter saying your premium's up 59%, as they did last year in California. We've seen health insurance premiums jump dramatically over the cost of living over the last decade. And over the last decade, we've seen more and more businesses shed coverage for their employees. The Republicans want to believe that there's certainty in that. The Republicans want to believe that that's a comfort to the American working family. The Republicans want to believe that that's a comfort to grandparents who see their grandchildren thrown off their children's policies. That's not a comfort. What is a comfort is the freedom to know that never again will you have to contest the arbitrary rulings of an insurance company about your pre-existing condition, about the coverage of your child's health care. Never again will you have to contest whether or not you will get help paying for your pharmaceuticals if you're a senior. Never again will you have to pay for a preventative medical checkup to try to keep you healthy if you're a senior. That's the certainty that this legislation presents. Last night I had a telephone town hall meeting with over 1,000 seniors in my district, and all of them, almost all of them, I'd say there are 3 or 4 that in the call, almost all of them wanted the certainty of knowing they were going to get help with their pharmaceutical payments. They struggle with the donut hole. They were appreciative of the $250 check they got last year, and they're appreciative of the help they're going to get paying for their pharmaceuticals this year. That's the certainty that we ought to reject by rejecting repeal of the Health Care Act.
Gentleman's time has expired. For what purposes, gentleman from Minnesota is recognized.